Sean. Wendy Chamberlain was mentioning a health group that hadn't met, and we got some clarification, I think, from Mr Rocky that hopefully they have. There's been coverage in the Scottish media in the last week of the disgraced Health Secretary in Scotland, still shamefully in position despite his claim of £11,000 of taxpayers' money, but he refused a genuine offer from the UK government to assist to reduce waiting times in Scotland. I wonder what your response is as part of the Scotland office. I know this came from a former health secretary, but it was a generous offer, and I've certainly got constituents who can't understand why they can't be seen in Scotland. They see this offer made to potentially get them seen quicker using the resources of the United Kingdom, and that's snubbed by the SNP.
I mean, I'm baffled by that, and I see, living where I do, near the border in Dumfries and Galloway, I see things going on between, when the floods happened in Carlisle, the Dumfries and Galloway ambulances went and helped, and that's been reciprocated. I know people come, there's people going backwards and forwards to get special treatment on certain things. There are, if you come back with some sort of foreign tropical disease, we don't have a tropical disease facility in Scotland, and you'll be treated in Liverpool or London. Or, there is reciprocation going on all the time, and there's reciprocation obviously with organ donation, and on it goes. And why he would have turned down that help to reduce waiting times is beyond me. I mean, I'm absolutely baffled by it.
So I would agree with that entirely, and as you know, Mr Ross, I represent a Borders constituency as well, and increasingly I'm finding local residents who they might be registered with a beric practice in England who are receiving treatment much more quickly compared to their neighbours who are registered with GP practices in Scotland. Over the last few years, there's also been an increasing trend where it used to be quite easy to get treatment south of the border because it was more practical and easy. If you live in the far east or the far west of the borders, it would make more sense to go to Carlisle or Berwick to get treatment. And increasingly, because of what we're told is direction from the Scottish Government, treatment must be provided in Scotland. That adds to waiting times. It makes it practically more difficult for patients to access treatment. So a whole variety of levels, it's becoming much more difficult to access health services in Scotland. But I share your frustration with the Scottish Government's failure to engage with the UK Government to try and alleviate that.